Hello and welcome to this episode of the Sex Plus Health podcast. My name is Sydney and I'm an intern at the American Sexual Health Association. Welcome to part 2 of our Disability and Sexual Health series. Today's episode is on implicit bias and ableism. To help us learn more about this topic, we have a very special guest. Nellie Galindo is the founder of Accessible Sexual Health, which is a mission-driven organization that seeks to advance access to comprehensive sex education for people with disabilities. She provides training, resources, and consultation for organizations and individuals who are seeking comprehensive sex-positive, neurodiverse, affirming, and disability-centered sexual health organization. Thank you so much for joining us, Nellie.
Thank you so much for having me. I'm really excited to be here.
Okay, I'm going to start us off with a question that is being asked of everybody. So what are some myths about sex and disability that you think are important to discuss?
Yes, there are so many. There are a lot of different myths out there. I'll kind of narrow it down to 5. The first one, which I think is kind of the biggest or most prevailing myth, is just that people with disabilities, and this could be anyone with any type of disability, but I typically see this applied more to individuals with cognitive or severe physical disabilities, is simply that they're not interested in sex, or that they're asexual, they don't have a sex drive. And that's not true. I mean, certainly are folks out there with different levels of libido, and there are folks who identify as asexual, but that's not the vast majority of people with disabilities. Just like the general population, we all have a sexuality, we're all born with a sexuality, and the vast majority of us are practicing that sexuality in some way, shape, or form. I think the next biggest myth that I hear pretty frequently, and again, I think this tends to err more on the side of individuals with an intellectual disability or a cognitive disability, is that they're not able to consent to sexual activity. So we tend to automatically assume that if somebody has some type of deficiency with their reasoning or judgment, that it automatically means they cannot consent, or they cannot, actively consent to any type of sexual activity. And that's not always the case. It can really vary. It's a really wide spectrum of, I may not um, be able to manage my money, or I might have a lot of difficulty managing my finances, but I absolutely can understand a sexual relationship, or I absolutely can understand when someone might be trying to coerce me. Or I may understand a sexual relationship, but I may have trouble understanding when someone's trying to coerce me. So there's really a large spectrum there. But the presence of a disability by itself, especially a cognitive disability by itself, does not automatically mean that that person cannot consent to sexual activity. The third common myth that I hear and see pretty often is that disabled people cannot or should not become parents. This has a long legacy of, individuals working with disabilities who are then calling Child Protective Services. There have been instances of individuals with intellectual disabilities, especially, having their children taken from them after birth or closely after birth. And I'll often just see a lot of prejudice online where there might be a video of a woman in a wheelchair who has a toddler, and you'll see people in the comment section saying, "Oh, she can't take care of a baby. Why is she taking care of a baby? Like, who let her have kids?" Right? So there's a common prevalent belief that if you have some type of disability, that you should not either be having children because you cannot care for them adequately, or there's often a fear that you'll pass it down to your child. And that has a lot of underlying ableism that I'm sure we'll talk about later too. I think another common myth is that we don't think about people with disabilities being part of the LGBTQ plus community. I think there tends to be the assumption of heterosexism or heteronormativity when we're thinking about people with disabilities. But especially, for me as a sex educator, and for sex educators in general, it's really important to remember that there are people with disabilities in the LGBTQ plus population. And when it comes to things like preventing HIV and preventing other types of STIs and other, sexual and reproductive health issues, we want to make sure that we are being LGBTQ inclusive with people with disabilities as well. And the last one, which is a big one, and I think we'll talk about this a little bit more in depth. There tends to be this myth, this thought that disabled people are not sexy, they're not sexually desirable, and so therefore they're not at risk of sexual assault. And this is absolutely not the case, unfortunately. And I think we see this outside of the disability community, right? If someone does, if they are the victim of sexual assault, we think, oh, well, what were they wearing? Were they wearing tight clothing or loose clothing, or were they doing something or saying something sexy that made them at risk? And that's not true. Like, we know that that's not true. And I see this happen with people with disabilities a lot, where we think, oh, well, they're not conventionally attractive, or they're not a sex figure or sexy, so we don't have to worry about that person being sexually assaulted. And sexual assault has nothing to do with any of that, right? Sexual assault has to do with power and control over another person. And that's where we see a lot of risk for sexual abuse, especially within the disability population.
Okay, since you brought the topic of sexual abuse up, is there anything that you think needs to be done to address this crisis other than what the seemingly obvious of raising awareness?
Yeah, and I think unfortunately we're kind of still at a point where we are raising a lot of awareness. Depending on the study you look at and depending on the subpopulation of disability that you're looking at, you could see an abuse rate between 3 or 12 times higher than the national average. Um, Typically women tend to be at a higher risk. People who have disabilities that are affecting their speech or cognition tend to be at much higher risk. And unfortunately, I think that there tends to be a cycle where, something happens in the news or something comes out about how prevalent sexual assault is, how much of an epidemic it is. And there's a lot of, hoopla around it. And then it kind of dies off, right? It dies off with the news cycle. And unfortunately, I think a lot of that has to do with some of the ableism that we carry in society, where, if I'm not actively seeing people with disabilities as part of my community, I'm not thinking about them, and therefore I'm not considering their needs when it comes to public policy, when it comes to inclusion within existing programs that help survivors of sexual assault or survivors of domestic violence. And that's actually one of the biggest protective factors, is actively being included in your community, having people around you who are safe, having a circle of support, having friends, having individuals outside of your household who know what's going on with your life and who you can turn to if something does happen. Because individuals with disabilities tend to be segregated a lot, even to this day, and they tend to have much smaller social circles, that increases their risk dramatically.
Yeah, I definitely remember growing up and having, there were classes for people with disabilities, and then there was the regular classes, and
Hmm.
very little did they interact with each other.
Yes. Oh, same.
Um,
It was the same thing for me.
like,
Hmm.
very little. Um, and I think that that is very important to have the integration and inclusion just with something as simple and common as school.
Hmm.
So from a young
Absolutely.
age, having kids and young adults be more aware of the people with disabilities that are in their community, that are in their neighborhood, their school. I think that can go a long way.
Yep.
All right, so we're going to go on to the next question. Implicit bias refers to attitudes, prejudices, and judgments that we unconsciously hold about people or groups. What are some ways that implicit bias impacts people with disabilities surrounding sexuality and sexual health?
Yeah, and I think yeah, I think you bring up a good point in, growing up, if we're not actively seeing people with disabilities as part of our communities, then we're not, again, we're not actively thinking of individuals as individuals. They're not in the forefront of our minds. And so I see a lot of implicit ableism come up, especially within providers, healthcare providers, or even disability service providers. And, like you mentioned, a lot of it is unconscious. It's not actively trying to harm someone or hurt someone. But even the idea of, oh, I didn't even think about hosting this party in a space that was accessible to wheelchairs, or, oh, I didn't realize that when we were planning this community health event, that there might be folks with cognitive disabilities who have difficulty understanding our health materials. I didn't think to include it in plain language, or I didn't think to include it in Braille to include folks who are blind. So, a lot of the things that we just miss because we're not used to seeing those things out in public anyway, it kind of perpetuates itself, right? We're just continually not seeing spaces where people with disabilities are actively being included in. And so that's continuing to create this idea that, oh, well, they must have their own space or they must have their own program. A lot of times they don't. It's also illegal. Everything needs to be made accessible if it's a public, public health event or something that's a private business, right? Like it all has to be made accessible to people with disabilities. But that implicit biasy of, oh, well, I'm not even seeing them. I'm not even thinking that they're here. It often just leads to more exclusion.
Yeah, I really do think also a lot of people automatically think of like, is the space physically accessible when there's so
Mhm.
many other aspects of accessibility that I think people don't always, that's not the first thing that comes to their mind. The first thing that comes to their mind is like, is there an elevator? And
Mhm.
if it's like not on the first floor, and if there's stairs, is there a ramp? But I
Yeah,
think there's so much more to accessibility than just the physical space.
absolutely. It's your policies, it's how you communicate. It's digital. Like, is your website accessible? Right? You might have the most physically accessible, beautiful building in the world, but if people can't find you on the internet because their screen reader doesn't work with your website, I mean, you miss out on that. So, yeah, there's a lot that goes into accessibility beyond just the physical environment for sure.
We've touched on ableism earlier, but how does ableism play a role in the sexual health and healthcare of people with disabilities?
Yeah, and just in case folks aren't familiar with the term, it's becoming more familiar, and I'm really
Mhm.
happy for that. But just in case, ableism just refers to discrimination of people with disabilities, and it's typically in favor of able-bodied people. And the way we kind of see this show up a lot, especially within healthcare, similar to implicit bias, it often just comes back to assumptions. Many medical providers again are assuming that myth that individuals with disabilities are not sexual, that they can't understand sex or they cannot consent to sex. And so things like just asking about sexual history often get missed. And I don't know if you're familiar with the movie Crip Camp. It's a great documentary on Netflix. It's about a camp that was for individuals with disabilities back in the 60s and 70s. And it was kind of the birthplace of a lot of the different disability rights movement individuals who kind of led that space. It's a great documentary. I highly recommend it. One of the individuals in that movie was a woman who had cerebral palsy. It very highly affected her speech. So she spoke very slowly and it was very muddled. She used a power chair. And she tells a story of how she was having a lot of cramping and she was almost feeling like she was having a UTI. And every time she went to the doctor, that's just what they diagnosed her with. They said, "Oh, you have a UTI, you have a UTI." And nothing was helping it go away. And finally, someone tested her for chlamydia and she tested positive. And she said, "This went on for months and no one even thought to ask me if I was sexually active." And she was. And so again, that kind of that assumption, that myth is an ableist one. It's one that doctors are not thinking of. And a lot of it, I think, comes back to we just don't have good training. We don't really talk about the specific needs of the disabled community and how these myths are interacting with how they're being treated in a medical setting. There's actually another example of this from a 2022 article in the New York Times, where they interviewed researchers who had granted anonymity to this focus group of physicians. And many of these physicians explicitly said, "Well, I don't want to work with patients with disabilities." They said that, or they had a lot of complaints about having to accommodate physical disabilities. A couple of them indicated that they would rather that individual go to a quote unquote special clinic than come to their clinic. They complained about losing money on sign language interpreters, right? Just a lot of things were coming out in this research study. And what was really interesting about the study is that the lead researcher was a woman with a disability, and she was experiencing a lot of biases and prejudices and just poor treatment from her care providers. And so she said, "Well, I just need to interview these doctors and kind of figure out what's going on. Why is there such poor treatment?" Um, and so those assumptions and those biases, they really end up leaving people with disabilities just receiving very subpar care. That's when we see, STIs getting missed. That's where we see, evidence of sexual abuse getting missed, right? And I mean, at the best, this subpar care is just annoying, but at the worst, it can be life threatening. So we're really putting individuals with disabilities in what I think is a terrible amount of risk and danger. That's either going to lead to more morbidity or early death, to be frank.
Yeah, I definitely agree about the providers and training. Um, I read a study it's a small study with just around 300 OBGYNs, and they found that only 17% of OBGYNs had received any information or training on the provision of healthcare to women with disabilities. And
Yes.
over 80% believed that women with disabilities are less likely to receive comprehensive reproductive health care. Not because they were going to be providing less comprehensive care, but that they didn't know how to provide comprehensive health care. And it was
Right.
like, it's not necessarily their fault, but so they didn't know how to provide the comprehensive health care, which made them believe that, which is true, that they're less likely to receive comprehensive health care.
Oh yeah. And I do think the majority of doctors and providers out there, like I don't want anybody listening to this to think like, "Oh, all healthcare providers are terrible to people with disabilities," because that's not true. But yeah, it's really just that lack of access to their training and their ability to skill up in these areas and get the types of knowledge and training that they need. Because I mean, doctors come into the profession to help people. But yes, there's so little of that made available. Very few doctors are trained during medical school. There's very little continuing education that happens that doctors can receive to support people with disabilities. And even in a lot of physical environments, doctors' offices don't have accessible equipment. So I may want to be able to provide a pelvic exam to a woman who uses a wheelchair, but I can't physically get her up onto the doctor's table that's 3 feet off the floor, right? So I do think that there is a lot of good intent out there, but it's a whole mess of, do we have the right training? Do we have the right equipment? Do we have the accommodations we need? And that's, what I'm hoping to solve at least.
Yeah. So we often hear that the reproductive justice and disability justice movements are separate from each other. Um, how are these movements intertwined, and how can these movements work together?
Yeah, so the reproductive justice movement, it really kind of focuses on four things, right? So
Mhm.
the first is just that you have the human right to maintain your personal bodily autonomy. You have the right to have children. You have the right to not have children. And you have the right to raise your children in a safe, sustainable community. Yeah, so we have these like kind of four main tenets of reproductive justice. But when we look at the disability justice movement, the right to bodily autonomy and self-determination, that's huge. That's, I think, is like the basis of the disability rights movement. There's a great phrase among a lot of disability rights activists: nothing about us without us, right? Like policies, laws, anything out there, nothing should be made about us without our input, without having people with disabilities at the table. So that right to autonomy, self-determination, that's a big similarity that both of these movements have. Alongside the right to raise your children in a safe and healthy environment, just like the myths we were talking about earlier with parenting. That's a huge one in the disability community right now. There's a lot of advocacy going on around making sure that parents with disabilities are supported. Um, the right to access healthcare free from political influence or stigmatization, just like what we've been talking about, right, with physicians and providers. And also just that right to community care. So the right to be able to live in the community of your choice, to have those around you be able to support you and you be able to support them. So really building an environment where we're caring for each other. I think that's a huge tenet in both of these movements as well.
Yes, I definitely agree. I think I've read plenty of articles, especially in preparation for this, but also separately, about how these movements are really intertwined. And
Mhm.
because a lot of the tenets are very similar:
Yep.
bodily autonomy, being able to make decisions for yourself,
Mhm.
being able to um, be a parent if you want to be a parent, and having those resources available. I
Yep.
think it definitely, like you said, seen in like the news and stuff about people with disabilities getting child protective services called on them, getting their kids taken away from them, and things like involuntary sterilization. So they don't even get the choice.
Yes.
So if somebody, because it is
Yeah.
still legal in the US and plenty of states to sterilize somebody with a disability without their consent. And so I think that that also really um, intertwines the disability rights and justice framework with reproductive justice, because the reproductive justice movement is very much against involuntarily sterilizing anybody. So I think that's another aspect of where they can really intertwine, and there can hopefully um, be some momentum to get some of those laws banned, overturned. What's the right word?
Yeah, I don't know.
And
Let's just ban it all. Let's change it all.
just
Let's
change
make
it
it so
all.
that it's like all bodily autonomy focused.
Yeah.
And I'm glad you brought that up because yes, the history of involuntary sterilization in this country is awful. To an extent, it's continuing today. And people with disabilities, especially people with disabilities who are also people of color and who are women, were vastly, vastly affected more than other groups. So that could be a whole other
Yeah,
podcast
it could. It really could.
episode.
Is there any information on STIs among disabled people? What can we do with this information? Because you mentioned it earlier about the woman in that documentary that had chlamydia, but nobody thought to ask her if she was sexually active.
Hmm. Yeah. So, in my own research, I wasn't able to find a lot in this area, which that's a prime example of ableism in our society, right?
Mhm.
Especially within our research institutions. We're
Mhm.
not often looking at disability as its own demographic. So I wasn't able to find a lot, but I did find a couple tidbits here and there. And overarchingly, yes, like the risk is a bit greater for people with disabilities, but it seems to depend a little bit more on the type of disability you have. So there was actually a study from earlier this year, from March of 2023, from the American Journal of Preventative Medicine, and they did find that the prevalence of STIs were more than twice as high for women of reproductive age who had cognitive disabilities or sensory disabilities. So that's specifically what they found within their study population. Outside of the US, there was a Canadian study done last year on men and women with disabilities, and they found that both men and women with any type of disability were more likely to report the diagnosis of an STI. So just as a general trend, they were more at risk. And I did find one study from 2019 that showed that individuals with IDD were just as likely, and I apologize, IDD is intellectual and developmental disabilities. Um, their study found that they were just as likely or less likely to experience an STI. But when I looked at the data, they were only including individuals who had private health insurance. And that was a little bit of a red flag for me because a lot of individuals with IDD are on some type of public assistance like Medicaid. And so I would just take that with a grain of salt. Regardless, though, I think what this indicates is that, especially as healthcare providers, as sexuality educators, we just have to assume that the risk is there and it's going to be just as prevalent or more prevalent for people with disabilities as it is for the general population. So we always want to do the same screening. We always want to do the same types of treatment and assessment for STIs, and the same type of education that we would with anyone else.
Those studies show that there is at least the same risk or an increased risk. Um, but I also think it's important with the ableism and implicit bias about sexuality and do people with disabilities, are they sexually active? And I think since there is this belief that or myth that people have that people with disabilities can't or don't have sex, I think it also increases the risk of untreated
Yes,
STIs. And
absolutely.
then they could pass that on to other people, and then it would create more of like a ripple effect.
Oh, yeah, absolutely. That's the thing, right? Is it's not just affecting that one individual, it's affecting any future partners that they're having as well.
Nelly, could you let people know how they can connect with you on social media or your website? And we will also put your information in the episode description.
Yeah, thank you so much. So you can contact me via my website. It's www.accessiblesexualhealth.com. You can email me at info@accessiblesexualhealth.com. I'm also on LinkedIn, Facebook, and Instagram, just at Accessible Sexual Health. So you can find me all those different ways. And I love talking to people. I do consultation and training and education. So feel free to shoot me an email and we can chat.
Thank you so much, and thank you for everyone for listening.